Mental Health Monday on Radio City Talk with Mick Coyle.
Radio City Talk.
Time for Mental Health Extra. My name's Mick for a Tuesday with Jake Mills from Chasing the Stigma in the studio. Jake, it's great to see you.
Hello. How are you?
Yeah, good, thanks.
I thought you were going to follow up with something. You caught me off guard there.
Oh, okay. We're on. We've started. It's good to see you. Thanks for coming in today, here to discuss mental health issues. Although it's on a Tuesday, we call it Mental Health Extra and follows on from the Monday show, which, by the way, just goes to show there's always stuff going on from a mental health point of view. If people haven't listened to it yet, 2 events taking place Thursday and Saturday with mental health very much on the agenda.
Yeah, I'm very sorry to not be able to attend the screening on Thursday. But I'm at another mental health thing in Edge Hill University. So yeah, no, it's great. It's great to hear about all the different types of things that you can do, particularly with the festival as well. Is that this weekend?
This weekend coming.
And yeah, it's great to have different ways to have people talking about it and breaking down that stigma that it's difficult to talk about when you can just get dressed up and have a laugh.
Brilliant stuff. The organisations involved there, Imagine Independence, do great work as well. Also the Liverpool Mental Health Consortium as well. Their websites have got all the information that you need about that. Jake, there's a story today which we've been touching on, and it's in regard to members of the emergency services. Now, this is something that we've spoken about this before with the Blue Light organisation, which does great work within the emergency services. But I didn't realise to the extent at which people within the emergency services, and the figures that I've got here are from the police, are particularly troublesome and particularly worrying. 8 out of 10 police officers are displaying signs of depression or anxiety as a result of, quote, doing too much. This is the chair of the Police Federation warning. 8 out of 10, 4 out of 5, that's not just, 50%. That is most police officers, most men and women who go about their lives trying to protect members of the public and serve members of the public are showing signs of depression or anxiety. If that was happening in young people, if that was happening in elderly people, we'd be, saying, hang on a minute, something needs to change here. Should we say the same because it's happening to the police? Absolutely.
I mean, these are the people we're relying on to look after us, and nobody's looking after them. It's scandalous, it's dangerous, it's irresponsible. I've tweeted about this today to say every one of us has breaking points. We all have breaking points, and we should never ever be pushed to those breaking points by our employers. That's what's happening here, and it really is dangerous on so many levels. I've travelled the country kind of talking to police forces, to emergency services, and every single time I do, whether it's Greater Manchester Police, Merseyside Police, Cleveland, West Yorkshire, I think I've spoken to as well. Every single time, the officers are coming to me afterwards to say they're struggling. They recognise what I'm talking about within themselves, within the colleagues, and that it doesn't seem to be any way that they can kind of recover properly because of the pressures that they're under. It's absolutely scandalous.
There's another story, and I'll link the two stories together before when I was talking to Pete Singleton from the Merseyside Police Federation, and I was saying, look, there's another story today about rest days. Record numbers are being cancelled and then unfulfilled because they go, look, you can't take the day off because we need you to do X, Y, or Z. And also, we can't then allow you to, take it off as a day in lieu because we actually need you to be on shift. And that idea that it's relentless work all the time where you don't get any time off work, it doesn't matter if you're a nurse, a teacher, a police officer, an architect or whatever, if you don't get time off, you don't get that recuperation time.
Exactly, and that's why the response from the Home Office to say that it's the responsibility of the local forces is just passing the buck. That's all that's doing. It as I say, it's irresponsible, and it's just plainly not right to be able to pile this pressure on. The reality is you can't be expected to look after other people if you don't have the time to look after yourself. You can't drink from an empty cup type of thing. You've got to be able to look after yourself before you can do your job. You've got to put yourself first.
I was speaking to Pete Singleton from the Merseyside Police Federation. We're just going to hear a clip from what he was saying. I was asking about the impact that those lack of rest days and that going to work with depression or anxiety or the symptoms of which within yourself going in through the office and then heading out onto the streets to try and protect and serve members of the public. What impact would that have? Let's take a listen to what Pete had to say.
I have to stress that, I think that the police officers of England and Wales, and especially of the police officers on Merseyside, are producing miracles day by day. But you cannot keep working people, to the maximum without giving them time to recuperate. We're flesh and blood, we're human beings, and there is a price to pay in all this, sooner or later. And my concern is, looking at my colleagues around the country, there are some places where it is starting to fail. We're not at that point yet, but if we don't see some new money in the next 2 or 3 years, my concern is that mental health problems, sickness and stress, people will just start falling over, and they'll end up going sick just to be able to get that time to recuperate. We don't want to reach that position. We can see it coming. We're not crying wolf here. This is a serious thing that needs addressing now before we get to that point.
Just on those figures as well, slightly different to the national picture. You just give those figures again, because they set out, although they're better figures, they're still pretty depressing figures when it comes to the Police Federation report that you got local stats for. Just run those by us again, Pete.
Okay, yeah, we've got 63% of officers who think their workload and responsibilities are too high. You've got 75% who are saying that the work-life balance isn't what they would like it to be. And you've got 74% believe the job has a negative impact on its health and well-being. Now, you've got to take into account, of course, in that you've got shift work. Now, all shift work, has an impact on your health and well-being. So it's not necessarily all overwork. But my concern is, with this freedom of information that, we owe 10,000 rest days is a concern, because that's 10,000 days that police officers should have been, at home recuperating and resting.
There you go. That's Pete Singleton from the Merseyside Police Federation speaking to me a little bit earlier on. I sort of use the phrase, they are depressing figures, but actually when we are talking about how we need workforces to be able to, set about setting up their staff to be positive and to be able to have mental health and well-being very much at the forefront of their minds, when you do hear that, you think, oh, that's not just, 20% of the workforce, 30%, 50%. We're talking about the majority of workforces. Those figures set out by Pete there, they were local figures. Now, he says they're better figures than the actual national picture. So a workforce there in Merseyside Police was 75% who were saying this workload is bad for my mental health and well-being and my physical health as well. That's worse around other parts of the country.
Yeah, it's something that simply cannot be ignored. What's happening is, and I think this happens anyway in general, is that the emergency services staff are seen as some inhuman, emotionless people who are just they're always there for you 24 hours a day. There's always these people there for you. If you can imagine the pressure they are under, the sights they have to see, the things they have to deal with, that is enough to push anybody over. They're the people who have to be looked after. Same with doctors, with nurses. The pressure that you're putting under, and then not giving them any way of being able to kind of overcome that. And again, this is something that I've witnessed from the things that I've done, the talks I've done, the people I've spoken to. I know that there was somebody at Greater Manchester Police, Adele Owen, who'd done a really good research paper on this, and Greater Manchester Police were really good at looking at how they can help that. You've got Michael Brown, mental health cop, on Twitter who talks about all this stuff, but it cannot be ignored from the highest level, from the Home Office, from everybody who's got that responsibility to look after the people, because if they're meant to look after us, somebody's got to look after them.
But in terms of who's looking after them, though, I mean, I've spoken to the Chief Constable of Merseyside Police, and he was the person who said to me, look, this mental health thing is going to be an issue which is going to be bigger and bigger. And I was like, do you mean in terms of the calls you're receiving? And he was saying, no, in terms of my own members of staff. And they're obviously doing their best to get by in the way that they are. I've got a figure here. There are around 21,500 fewer officers on the streets now than 9 years ago. 9 years ago was, pretty much, the start of the Lib Dem Conservative coalition. They're aware of that, but it's about how you put things in place. But, within the NHS, when it gets to flu season, doctors and nurses get offered the flu jab because they need the people who are going to deal with the flu to not be affected by the flu. But actually, the emergency services, be it police, ambulance services, or anyone in between, they might be the front line dealing with a mental health trauma or mental health case. And actually, if they're suffering themselves, they're not in the best place. Maybe they're not right frame of mind to be able to deal with that in the correct way, which is a worry, isn't it?
It is, and that's what it all comes down to, is the cuts on all levels, because then suddenly the police are having to deal with things that it's not actually a police role or police job to have to deal with, but because of the cuts to the mental health services, they're having to do that. It's early intervention and prevention, which is lacking, and the cuts to that is putting more pressure on the police. And then it's exactly as Pete said in his interview as well, is that you're talking about getting more officers out there, but actually it's not more officers, it's the same officers just doing more jobs. That's why the people who are in charge, the people who are responsible to look after them, are the people who are implementing the cuts. They're the ones who have to take responsibility for this, because it is their responsibility to look after the well-being of all of us, and that includes the emergency services staff.
Callum MacLeod from the Police Federation. Nationally, what we're seeing is 8 out of 10 officers in a recent survey have come back and said they are feeling symptoms of anxiety or depression. That is a very startling figure when you look at the amount of police officers in the UK. They need to recuperate to provide the best possible service to the public. If officers aren't feeling refreshed and having rest between their shift patterns, what you find is that the situation of their mental health is exasperated. It's a concerning set of figures. There's, by the way, just on that one, and I'll just mention this because, you know, you'll look at both sides of this story. 4% of police officers said their current workloads affected them positively.
Yeah, and you know it's important to focus on the 4%. You know, it's a national outrage, and it should be treated that way. And I hope that people do treat it that way, and it doesn't just go away quietly.
Jake Mills is with us from Chasing the Stigma, and also the man who set up the Hub of Hope. That's the same person, Jake Mills.
Yeah.
I was going to introduce somebody else, Barry. It's Mental Health Extra, and if you want to have a comment on the show, if you want to email the programme, you can do mick@radiocity.co.uk. Are you going to do some shout-outs now?
I've got some shout-outs to do. First of all, from our friends, Mick, a Happyful magazine, because the latest issue is out now, and that is actually where I read the story today about the emergency services and stuff, and just to give them a shout out, because what their magazine is, Happyful magazine, is a mental health focused magazine, and it's absolutely brilliant. It's I said this to them, so I don't mind saying it again publicly. When they first got in touch with me to tell me about the magazine, I thought it's going to be a bit like a newsletter, you know, a little student magazine type of thing.
Sort of thing me and you put together.
Yeah. Only not as rubbish as that. But the magazine itself is absolutely brilliant, and it's available in stores as well. It's in Waitrose. I don't know whether I should have found out, but it's online as well. So please check them out on Twitter and online. And I've got another one for a company called Behind a Smile. Don't know if I've told you about these before, but they're a clothing company who are focusing on tackling the stigma associated with mental health through fashion. And they're again, I don't know why I've got low expectations of people, but the quality of their products, from hats, I've got a couple of hats from them, the t-shirts, the hoodies and everything, is brilliant. It's really, really top quality, and there's such an important way. Again, it's looking at these different ways of how we can address that topic and have that conversation. So Behind a Smile, they're available online on Twitter and social media.
Excellent stuff.
Give them a shout.
I like the way you do that. You sort of go, now, you know, Jake Mills is with it. Now, he sounds like a charlatan, and in many ways he is, but actually he's all right.
Yeah. And he expects other people to be as well.
He's got very low standards, and he's easily surprised. But Happyful's a great magazine. It's a glossy magazine, and that's the other thing as well, that people think, oh, it's a mental health magazine, like it's going to be clinical, and it's going to be, you know, turn to page 3 to hear about depression. It's not like that. It's just a lifestyle magazine, but it focuses on mental health.
It's brilliant. It really is.
There's a story which I wanted to sort of raise as well, which I read about this week. These sort of numbers have been bubbling under for quite a while, so I wanted to touch on it. There was an international suicide prevention conference in New Zealand. We didn't get an invite to that one, did we?
I did. I went.
Oh, you did?
Yeah,
but it was talking about numbers, looking from the ONS, Office for National Statistics numbers, about suicide rates among UK students. Now, one set figure says that figure is now higher than among the general population. And there was a presumption that actually students were kind of better off from a mental health point of view. And for the first time, figures suggest actually suicide rates are higher than the general population, although the ONS said, well, you can never really tell because there's changes in the population of students across time as opposed to changing the risk of suicide. But I thought a good opportunity to talk about these numbers. Research say between 2007 and 2016, this century, student suicide rates increased by 56%. 2016 figures showed that 146 student suicides, the highest in records going back to 2001. That strikes me as an incredibly high number. Between 01 and 07, there have been a pattern of falling numbers, but since then, numbers have tended to rise. Now, students, yes, they're adults and they're in an adult environment, but it is still an environment which is walled within an institution and a university. There are duty of cares right along the line on this one as well, but it's a concern if there is any section of society which is starting to show signs that they are more likely to take their own life. Yeah,
I think generally with university, it's almost like it's a practice of adulthood, isn't it? It's your first experiences. For a lot of people, it's moving away from home. It's that responsibility. It's the kind of the isolation as well from what you're used to. And yet, this is a serious thing that we need to be considering, and it's similar to what we were talking about with the emergency services, and something that you discussed on the podcast yesterday as well with Annie and Olga. About this disconnection with social media and everything else, and that can lead to all this kind of the false, almost a false security to what life is meant to be like.
Yeah, and I think that's one of the issues with saying that you're framed within the protection of an institution like a university, which might be a prestigious name. You don't feel like that when you're that age. When I was at university, my last 6 months at university was an absolutely dreadful time for me. And I look back now and I just think, what on earth was going on in my life? But really, I could have just gone, you know what, I'm just going to go home for a bit. I could have commuted from me mum and dad's. I could have slept in their bed where I was going. But I thought, no, this is. I felt like the pressure was on because actually this is the start of your life. This is the start of you going out. And I kind of thought at the time, I need to crack on with this one. I need to deal with this. Whereas really what I needed to do was go and sit on a beach somewhere for a bit and do absolutely nothing for quite a long time.
Yeah, and if you can imagine as well, if you add on top of that the modern world that we're living in at the moment anyway, with technology, as you were discussing yesterday, and that kind of the social media, all the pressures that come with that, as well as that kind of isolation that comes with it. I mean, I know from speaking to universities that they do see this as a really important topic. They do want to do something about it, but they don't necessarily know how or the best way to tackle it. And again, it's something I jotted down when I was listening to the podcast yesterday about that idea of not being able to turn off the jobs, the lectures, or all that stuff that kind of you're not being able to turn off from this kind of internet world, the social media world. But that's not going to go away. That's not going to go away. It's only going to get bigger and wider, the kind of the mediums that we use. So it's about, instead of saying, well, this needs to stop or this isn't good enough, it's about how you then use it to your favour. And that's something it's going to take a big turn, really, but it's something that we have to consider. You can't ignore what the current lifestyle that people are living, and it's about how we can use that to help people, as well as it being or instead of it just being a nuisance sort of problem.
When I was at university, it was the April Easter holidays. This is 2003. And I was really at the end of my tether in terms of what I was capable of giving to this course anymore. I'd had absolutely enough. And I'm looking back now, absolutely certain that depression was a major issue for me. And I got offered a work experience at Radio 1, which was Radio 1, the big BBC national station. And it was like a 2-week placement and no accommodation, nothing like that. I had to just go and find. I ended up staying at my mate's grandma and granddad's, and I just got on a train to London and went and stayed at their house. It was the oddest and probably one of the worst experiences of my life, outside of the experience of obviously working at the radio station. Not that they weren't absolutely lovely, because they were, but when you just thought, I don't need this now. This is no use to me whatsoever. This is my last chance to have a break before deadlines and everything kicks in. And I never got it. Instead, I got something which was an even more sort of heightened experience where I had to be even more switched on and even more sort of clued up. And I remember coming back from that and I was mentally exhausted from the experience. And I don't look back at it now particularly positively, although, you know, it was like, oh, you get to meet Sarah Cox and that, great. But I think I look back and I just think that was not a good time for me.
Yeah, I mean, if you talk about anxiety, I mean, that must have been a fair play to you for doing that, because that I wouldn't have done that. I don't think I'd be able to have coped with that. And staying with people you didn't, did you know your mates?
Never spoke to them after that either, other than to send them some flowers to say thanks.
Yeah, fair play to you for doing that, because, but again, this is what it's about, because you don't know, so you think, I've got to do this.
Well, that's what it was.
Because you think you're in that world where you're thinking, I've got to do absolutely anything I can for my future. So you take these things, and yet, all right, now you're working at a radio station, but was it because of that?
No one's ever asked me about it, and I never bring it up.
Do you want me to?
I don't have a particularly positive experience there. But yeah, strange time. Jake, we're out of time. Thank you. Any more shout-outs you want to do, by the way?
Not at the minute.
Have you got any events coming up that you're going up to this week?
Yeah, Chill. I think there's the student union at Chill are doing an event on Thursday, 5:00. I think they've got information on their website and social media channels as well.
Brilliant stuff. If people want to find out about local mental health services in their area, the Hub of Hope is a great point to head to.
Yeah, hubofhope.co.uk. You find out more information on chasingthestigma.co.uk. It's available to download on iPhones, nearly available on Android as well.
Brilliant stuff. Can't wait for the Android one. He says, looking at his Android phone. Jake Mills with us on Radio City Talk. Mental Health Extra falls on a Tuesday from the Mental Health Monday show, which you can check out via podcast. You can check out them all for free. There's 60-odd episodes as well. You now get the supplementary Mental Health Extras. And if there's a story or an event you want to tell us about, drop me an email, mick@radiocity.co.uk. That's mick@radiocity.co.uk.
Mental Health Monday
On Radio City Talk.
with Mick Coyle.
Tackling the stigma.
Radio City Talk.